Yes, here is your stem.
Is Dr. Ahmed with us?
Yeah, I am with you, but just writing.
Reading, yes.
Yeah.
Let's go read.
Okay, I am ready. I am ready.
Are you sure? You can take your time.
Is there any labs or just this page?
Just this page.
Okay, I am ready.
The rest you can assume or whatever you've read from your traditional notes.
I didn't read. I just
Just saying. Okay,
yeah.
so
It's
once
random. It's real like a real exam. I
yes.
didn't review.
Okay, ready?
Yeah, ready.
Right, so if you've read and understood, considering it communication skills station, please begin.
Hello, I am Dr. Ahmed Awad, one of I am S2 from Saint Peter Hospital, working for Mr. Mann. I am calling a vascular surgeon to ask him for referring a case with acute lower limb ischemia. Can I confirm that I am calling the vascular consultant?
Yes, I'm Jack, the vascular consultant on call.
Hello, Mr. Jack.
Please
Today I have
summarize the thing.
yeah. Okay. Today I have a patient, 54 years old female patient, admitted as a case of mild diverticulitis, and we treat her accordingly with IV fluid and antibiotic. The patient condition improved, but suddenly the patient developed a left lower limb pain. After that, we did Doppler ultrasound and it show acute left lower limb ischemia. For that, we are calling you to refer the case for your care.
Okay, does patient have any cardiac issue and have you done any ECG?
Yes, the patient is known case of preventricular tachycardia. The ECG showing AF and her ABG showing metabolic acidosis. Also, other labs showing hypokalemia in her ABG.
Okay, doctor, is it urgent? Can you send her tomorrow morning instead?
Sorry, doctor, but the case is urgent. The patient have acute left lower ischemia. She need urgent referral for your care and early management.
Okay, do you need any cardiologist to review before transfer?
For sure, the patient need a cardiologist, but after transfer, because the patient have acute lower limb ischemia, it is a critical case.
And what do you
Yeah.
think of her, and what do you think of her presumed diagnosis of diverticulitis?
It could be a diverticulitis, but in the front of the new onset AF, it could be mesenteric ischemia also.
And do you want to scan the abdomen first?
Yes, maybe she need a scan for her abdomen, but after transfer, the patient need urgent intervention for her left lower limb ischemia.
And what if her renal function is not normal?
Her renal function. Sorry, I didn't find the renal function, but once I finish this call, I will do a new renal function test, and I will update you about this.
And how could you manage this case?
This case need, according to CRISP protocol, she need airway, breathing, circulation, IV fluid. Also, she need CT scan for her angiogram for her lower limb. Also, she need intervention for her lower limb ischemia by stent
And
or bypass.
what do you think about her serum electrolytes and how to manage her
The
AFib?
patient, the patient have hypokalemia, and she have 2.6 millimole of potassium. So she have a decrease in her potassium. We can give her a potassium replacement KCl 10 milli equivalent, and we repeat it every hourly under cardiopulmonary observation.
And how would you manage her atrial fibrillation?
Atrial fibrillation, it need to see if it is an acute or chronic atrial fibrillation. I should know the baseline. If it is recent, we can if the according to the rhythm and rate of the heart. If it is an acute, we can start the rhythm control by amiodarone. Also, we should also treat the cause of the AFib and involve the
Okay.
cardiologist. Yeah.
Okay. And if you give her anticoagulants, what type of anticoagulant will you give?
We can give her heparin, heparin, and after that, maybe she need warfarin.
Okay. And how could we manage her limb ischemia?
Her limb ischemia, it need an intervention after scan, like stent or bypass.
Okay. And what type of ambulance will you need for the transfer?
Blue colored ambulance with CPR equipment and communication equipment.
What will you tell to the family?
I will tell the family about her condition, that she developed lower limb ischemia, which is an critically I mean it is a critical event, and she need an urgent intervention, and we don't have a vascular surgeon, so for that we are transferring the patient.
Okay, you can send the patient over.
Okay, thank you.
You still have 1.5 minutes left. Okay, you can discuss about the renal functions like you were asked. In case you get the labs results back and you realize that patient has deranged renal function test or deranged urea creatinine,
Yeah.
which anticoagulant would you choose then?
I will give her low molecular weight heparin.
No, unfractionated. Yeah. And what dose?
Unfractionated.
Yes. What dose would you give?
I will give her 80 milligram. 80 milligram
It's in
international.
international unit. In
Yeah, international 80
Okay. Then
80 international IV, then 18 international unit per hour.
is it the same if a patient would have a normal kidney functions? Then which anticoagulant you would give, and in what dose?
If it's the renal function is normal, we can give her low molecular weight heparin.
In which dose? Loading dose?
I know it's 40 milligram, 40 international unit
Yes.
BID means twice
Twice a day. But then one should give. All right. Okay.
But by dose, if it's therapeutic, I think it's 1 international unit per kg.
Per kg, yes. Now you're
By
telling me
the
correct, because you cannot just determine it like this. It has to be individual,
Yeah.
calculated because of the body weight and body mass index, and considering the comorbidities of the patient and the age and everything. Good.